As you're seeing these moms, what do you think the most moms could use support with postpartum?
Oh my gosh, perinatal mental health.
Mm-hmm.
Period. That's it. It's perinatal mental health. I don't know how, I don't know why. It was a brain fart. It had to be. But like while creating the clinic, I was like, I need a counselor.
Mm-hmm.
I need a counselor or a therapist, psychotherapist, a psychiatrist, someone that I can have on my payroll in a way that's kind of like a consultant, because I have the perinatal mental health, you know, the certification situation you go through with PSI, but that still doesn't replace an actual therapist or counselor. It helps with the screening process, and it helps stop it, not stop it necessarily, but to like recognize it before it gets to a certain point. Don't get me wrong, it's been an amazing tool, especially when while you're postpartum planning, helping them postpartum plan. You also can like, let's do a screen, because it should happen during pregnancy anyways. Perinatal mental health is the number one thing. Getting a counselor contracted with the clinic was the single most best decision I ever made. I didn't realize how big of a thing it was. And of course I had to, because I took the certification, took the webinar, did the classes and all of that. But until you're really in there and you're in a space where you're solely focused on postpartum and lactation, and then you realize how that can have an effect on mental health as well, on top of just hormones in general during postpartum, is insane. And so a lot of my research behind the clinic is breastfeeding related, of course, but also perinatal mental health related. How to just look at that differently, and why it's important to make that part of the care team and part of the care plan. You know, maybe we might need to change some protocols when it comes to certain things, but that's yeah, perinatal mental health during the postpartum period. If you can get anyone that's a perinatal mental health person that's able to screen you, you can keep your screening if you want, take it into someone who's able, and then they're able to refer you out to a counselor that can take cash, that's not that expensive, or that's covered by your insurance, because once they recognize you have perinatal mental health or some type of you're having little complications or difficulty, they'll cover it that way as well. But yeah, a lot of folks don't know their options when it comes to that, and they don't know what to call it.
If someone comes to you and they're like, I want to come in for my, postpartum appointment, they're not really sure which angle or what they really need at that point, what does a normal appointment kind of look like?
So it depends on where we are on the spectrum. You can get a membership right before you give birth. You can get a membership in the middle of, the process of postpartum, or you can just tap into just a regular appointment. It really just depends. But usually it's where you are. So 3 months, there's a process, there's steps, there's certain things that will happen at certain moments, kind of the same with baby development, basically. And so it really just depends on where you're at with that. And then from there, we go from there. So for instance, if I am chatting with someone who just recently gave birth, and I'm chatting with them, I'm also doing a follow-up when it comes to baby, latch, all of that. I'm doing a follow-up with them. And so it's kind of like, how are you feeling? Where are you now? What's going on with your nipples? Because if you're first starting to breastfeed, and I'm probably seeing you maybe 2 or 3 weeks after the fact, then the main concern is, how are you healing, and how are your nipples? So we're talking about that. I'm educating you on breastfeeding, and while also doing my own little appointment with baby. Okay, let's check latch, let's check milk transfer. How was your birth? Tell me the story. Let's unpack it. So that's kind of what it looks like when I'm teeter-tottering between the two during an appointment.
Awesome. Yeah, that's really great.